Hi friends, welcome to Origin Fertility and IVF. I am Dr. Rashmi Sharma. So today I am going to tell you about ovarian rejuvenation or intra-ovarian platelet rich plasma therapy. First of all, what is platelet rich plasma? So as you understand, platelets, I think you have heard a lot with the dengue fever, and plasma, I think also you have heard a lot about from the COVID times. Okay, so we are talking about your blood. Your blood has plasma, which is like fluid, and it has multiple cells. Some are red blood cells, which are like blood cells. Some are white blood cells, which are infection fighting cells, and there is one very important cell, which is platelets. And platelets are very helpful in coagulation of the blood. It is helpful in clotting of the blood and also wound healing and tissue regeneration. So whenever you have a cut, whenever you have some injury, what happens? Immediately the blood clots, that is the platelets, and also the tissue healing starts. So we know whatever growth factors platelets release, and there are many like transforming growth factors, epidermal growth factors, and insulin-like growth factors. There are many growth factors which are released by platelets. These are helpful in regeneration of tissues. And in fact, clinically also, this regenerative property of platelets have been used a lot in the hair follicle growth, right? PRP is injected into the hair follicle for bald people. It is being used a lot in dermatology, also in orthopedics where it is used for wound healing, also in cases of arthritis. In eye also, a lot of people use platelet rich plasma. So from a lot of other branches of medical science, we know that platelet rich plasma or these platelets are somehow helpful in tissue regeneration. So from there only the theory came that if PRP can help in growing a hair, can it help in growing few more eggs from the ovaries? Okay, so now we come to its role in IVF or in fertility. Okay, one of the very important role, and that is very recent role, is in cases of premature ovarian failure or premature ovarian insufficiency. So I am talking about women who have very little number of eggs in their ovaries, or whose ovaries are almost dead, or maybe they do not have any eggs, like menopausal women. Okay, but they really want a baby from their own egg. Okay, so this therapy has been tried wherein your blood is taken out around 40-50 ml, and there is a whole laboratory process to separate platelet rich plasma, right? And that plasma is separated and it is injected into your ovaries. The procedure of injecting is just like ovum pickup. Right, you are anesthetized, and with the help of an ovum retrieval needle, we inject PRP around 1 ml, 2 ml into both ovaries. And in about 3 months, we assume that whatever dormant ovarian stem cells were there, maybe they will be activated, and maybe it will lead to formation of few more eggs. Now coming to the studies, is it helpful? So I would say it is still experimental and it is still not yet completely proven. But yes, there are many suggestive studies. There are many studies which are in favor of intraovarian PRP. Recently, very recently in 2024 itself, a huge meta-analysis has published which says that yes, intraovarian PRP injection can help you in making of your own egg. So there are case reports where even a menopausal woman who had stopped having menstruation actually started having menstruation, and many of the women have had spontaneous pregnancies following the injection of intraovarian PRP, though it is still an experimental technique. But for women who have no other choice, whose eggs have just finished or they're very little, they might consider doing intraovarian PRP. So we are doing cases of intraovarian PRP at our center. If you wish to consult, you can see the number on the screen below. You can you can give a phone call and take an appointment. If you wish to consult online, the link is given in the description box below. You can give us a phone call and take an appointment. Thank you.